Elizabeth Warren didn't just clash with Robert F. Kennedy Jr., she torched him for breaking one of the biggest promises a health leader can make. This wasn't about politics. This was about trust, public safety, and the very future of vaccines in America. And what happened in that room should alarm every parent, every senior, and every family watching.
Thank you, Mr. Chairman. So, last November, while you were under consideration to become Secretary of Health and Human Services, Mr. Kennedy, you said, quote, "If vaccines are working for somebody, I'm not going to take them away." No exceptions, no ifs, ands, or buts. You would not take away vaccines from anyone who wanted them. Then last week, you announced that the COVID-19 vaccine is no longer approved for healthy people under the age of 65. In announcing the change, you said the vaccine will be available for anyone who wants it. Now, obviously, both things cannot be true at the same moment. So let's clear this up right now, Secretary Kennedy. Will you tell America that all adults and all children over 6 months of age are eligible to get a COVID booster at their local pharmacy today?
Anybody can get the booster.
I'm sorry?
Anybody can get it, Senator.
Anybody. So you're saying that is now the official rule of HHS. Anybody is eligible to get a booster by just walking into the pharmacy.
It's not recommended for healthy people.
No. If you don't recommend, then the consequence of that in many states is that you can't walk into a pharmacy and get one. It means insurance companies don't have to cover the $200 or so cost. As Senator Dr. Cassidy said, you are effectively denying people vaccines.
We're not going to recommend a product for which there's no clinical data for that indication. Is that what I should be doing?
What you should be doing is honoring your promise that you made when you were looking to get confirmed in this job.
You're going like this.
And that is, you promised that you would not take away vaccines from anyone who wanted them. You just changed the classification of the COVID vaccine.
I'm not taking them away from people, Senator.
It takes it away if you can't get it from your pharmacist.
Well, most Americans are going to be able to get it from their pharmacy for free. Most Americans will be able to get it from their pharmacy for free.
The question is everyone who wants it. That was your promise.
No, I didn't. I never promised that I was going to recommend products for which there is no indication.
When you said...
And I know you've taken $855,000 from pharmaceutical companies, Senator.
Did you hold up a big sign saying that you were lying when you said that? Because you are the one who said you would not take them away. Now, Senator Kennedy,
I'm not taking them away from anybody.
Secretary,
you want me to indicate a product for which there is no clinical data?
Senator,
is that what you want?
Secretary Kennedy, you said you wouldn't, and now you did.
I'm not taking them away. Everybody can get access to them.
No, they can't walk into a pharmacy the way they could last month and get access.
It depends on the state. It depends on the states.
A year ago,
but they can still get it. Everybody can get it. Everybody can get it, Senator.
So look, let's move on. You clearly are taking away vaccines. I've seen the list for what's coming up next, and that is the agenda for the next CDC vaccine panel. And first up is ratifying your COVID actions. Second is hepatitis B is on the agenda. So should Americans expect you to take away hepatitis vaccine access as well, even though you promised not to?
As I said, I'm not taking vaccines away from anybody.
Okay, same answer, right? You're just going to deny that when people can't get access, that you're not taking it away. Then let me ask you, is that the same game you're going to play with me?
You want me to recommend every product in the world?
No,
so that without any clinical trial data.
Through on your promises.
Yeah, my promise was to give.
A month ago, we could get COVID vaccines by just walking.
You can still get COVID vaccines, Senator.
You are taking that away.
No, you are still. You can still get the COVID vaccines, and Medicare will still pay for them, and Medicaid will still pay for them.
Tell the head of the CDC that if she refused to sign off on your changes to the childhood vaccine schedule, that she had to resign.
No, I told her that she had to resign because I asked her are you a trustworthy person? And she said no. So if you had an employee who told you they weren't trustworthy, would you ask them to resign, Senator?
So I'm sorry, but this is not what she has said publicly. She has said
I'm not surprised about that.
So you're saying she's lying?
Yes. Every conversation I had with her, there were
let me get
witnesses.
this straight. This is the same person that less than a month earlier, you stood next to her and described her as unimpeachable, and you had full confidence in her, and that you had full confidence in her scientific credentials. And in a month, she became a liar?
Yeah, you should ask her what changed. And by the way, a month ago, you were voting against her. Oh, because you thought she was either incompetent, ineligible, or unsuited to the task.
I voted against her because I was afraid she was going to bend the knee to you and Donald Trump. And it looks like she didn't bend the knee, so you fired her. Look, you're putting America's babies' health at risk, America's seniors' health at risk, all Americans' health at risk, and you should resign.
Senator Sanders.
What you just saw was not just a heated Senate exchange, it was a collision between promises and reality, between political rhetoric and public health responsibility. Senator Elizabeth Warren didn't just question Robert F. Kennedy Jr., she exposed the cracks in his credibility as Secretary of Health and Human Services. Let's step back for a moment. Kennedy made a very clear promise when he was being considered for this powerful job. No exceptions, no conditions, no buts. I will not take vaccines away from anyone who wants them. That was a simple, straightforward commitment. Why did he say it? Because he knew it was what Americans needed to hear at the time. Parents, seniors, and families wanted reassurance that their choices would not be taken away. But now, when Warren pressed him, we see the story shifting. Under his leadership, COVID-19 vaccines for healthy adults under 65 have been stripped of approval, meaning they are far harder to access. Insurance won't always cover them, and pharmacies may no longer provide them. Kennedy's defense? I'm not taking vaccines away. They're still technically available. But Warren cuts through that smokescreen. She points out what so many families already know. When access becomes limited, when cost becomes a barrier, when availability is patchy, that is taking it away. It's the difference between a promise on paper and lived reality for millions of people. This is why Warren's frustration feels so raw. It isn't just about the COVID vaccine. It's about trust. It's about what happens when the government says one thing but does another. And it's about the devastating consequences when public health becomes a political battlefield. Because, let's be honest, when leaders waffle on vaccines, it doesn't just affect one virus or one community. It undermines confidence in the entire system, from measles to hepatitis to the flu shot. That erosion of trust has ripple effects that can last for generations. And here's what makes this clash even more revealing. Kennedy tried to paint himself as the guardian of transparency, claiming he wouldn't endorse products without clinical data. But at the same time, he's firing health officials, rewriting rules, and contradicting his own words from just months earlier. The pattern here isn't about science, it's about control. And Warren wasn't about to let him dodge accountability with clever phrasing. For families watching, the implications are real. Parents are left wondering, will my child still have easy access to the vaccines that keep classrooms safe from outbreaks? Seniors are left asking, will my booster still be covered? Or will it cost me hundreds out of pocket? Everyday Americans are stuck in the middle, while leaders play semantic games about what access really means. What Warren did in that moment was give voice to those fears. She turned the spotlight on the contradiction between Kennedy's promises and his policies. And in doing so, she reminded us why this debate matters, because public health is not a talking point, it's a lifeline. And let's not overlook the deeper lesson here. When politicians change their tune depending on the moment, they don't just lose credibility. They weaken public trust in science, in government, and in the very idea of collective responsibility. That distrust is already fueling vaccine hesitancy and giving cover to misinformation. The more leaders like Kennedy blur the lines, the harder it becomes to rebuild faith in institutions designed to keep us safe. Warren's anger, then, wasn't just partisan fire. It was about something fundamental, integrity. If the Secretary of Health and Human Services cannot be consistent and truthful about vaccines, something that directly affects the health of every American, then how can the public trust him on anything else? This is why we must pay attention, because this debate isn't just about COVID or about one Senate hearing, it's about the future of public health. It's about whether leaders will honor their word or rewrite it when it's politically convenient. And it's about whether ordinary people, parents, teachers, doctors, communities, will have the resources they need to protect themselves and their children. So I want to hear from you. Do you think Warren was right to call out Kennedy this aggressively? Do you think he broke his promise? And what does this say about the future of vaccine policy in America? Drop your thoughts below, because this isn't just politics. It's about all of us and the choices we make for our families. If you found this breakdown helpful, make sure you like, share, and subscribe to Liberal Lens. Together, we'll keep exposing these contradictions and fighting for accountability where it matters most.